Welcome to Hiranya Medical Service. 5 minutes to a better health by our eminent doctors.
Hi friends, I'm Dr. Anand Chockalingam. I'm a cardiologist at the University of Missouri in Columbia, United States. It's a pleasure to meet with you. I invite you to connect with this www.hilifejourney.org. We have, over the last 5 to 6 years, developed a mindfulness, self-inquiry meditative program directed at helping heart patients. We started this in 2015 as a formal group clinic in the VA system to help veterans to cope with 10 medical problems, 25 medicines, stress from family issues at the age of 70 when they have so many other health challenges. But now what we are finding is these mind-body methods are way more powerful and important in helping people cope with not only illness, but throughout the lifespan we can prevent illness. So now we have expanded in the COVID era and moved much of this material online. We have kept all of this material, which is several 8 hours of this Heartful Living course, and we have a physician burnout course and several other very interesting concepts which connect how our mind, our body, and our energy are directly connected, and how we can optimize our heart health, reduce risk for heart attacks, and in the same time find how we can optimally engage with our work and creativity. Let us see what stress cardiomyopathy is. We may all recognize that mental stress is not good for the heart. It can cause heart attack, high blood pressure, and long-term problems. What we are going to discuss today is acute mental stress. It may be for a loss of job or a death of a near and dear one, worrying about losing money in the stock exchange. It can be any mental stress that is sudden and acute. If it is severe enough, sometimes it may not even be severe. It may be just perceived or subjective stress. That, for instance, a patient of mine got a wrong phone call. By mistake, someone called him up, but they ended up in an argument instead of hanging up the phone. Next morning, he woke up with stress cardiomyopathy. So what is the stress cardiomyopathy? When there is mental stress, we do not recognize how much catecholamines surge. These are the stress hormones that nature has given us to cope with the physical threat to our life. Like in ancient times, prehistoric human beings had to defend themselves against wild animals, against predators, and sometimes have to run so hard just to catch some food. So whenever we are under physical demand and stress, the body secretes a lot of catecholamines, epinephrine, norepinephrine, and cortisol, and these are meant to give us the extra boost of energy to overcome the challenge. Even these chemicals are secreted from in the modern age. When it is secreted due to mental stress, the heart sometimes is overwhelmed. When the heart is overwhelmed, it, instead of squeezing at about 60-65%, which is the normal ejection fraction or squeeze of the heart, it can drop dramatically to about 20 or 30% within minutes. So when a person gets stressed at 10 a.m., he may have some chest tightness or trouble breathing by 12 a.m. within 2 hours. And when we do an ultrasound on the heart, immediately we are able to see within 2 hours of the acute mental stress or 6 hours, we may be seeing the heart squeeze has dropped dramatically. Based on the pattern of the heart dysfunction, we are able to sometimes estimate that this is truly Takotsubo or stress cardiomyopathy. But sometimes we think it is a true heart attack and we do the angiogram and attempt stenting. But what I want to emphasize here is mental stress can acutely weaken the heart and put our life at risk. We cannot avoid all the stress, but we have to be cognizant that if we can minimize stress and cope with it better, our health and wellness will be much ensured.
Thanks for watching. Do like, share, subscribe and click the bell icon button to receive instant updates.